Continuing with violence in the country, hospitals and medical staff who are already stretched to their limits by COVID-19 now have to cope with injuries and disruptions caused by the unrest. Life Healthcare CEO Peter Wharton-Hood joins me now to discuss the serious implications of the protests and looting on an already stretched healthcare system. Peter, many thanks for your time this evening. Paint a picture for us on the impact on hospital staff and the facilities that you've seen in light of the protests that have been taking place.
Before I start, our heartfelt sympathies to those families that have lost loved ones in the riots. We've had to record deaths in our hospitals as a result of COVID, and now I'm standing here in front of you talking about deaths from riots. Let's just step back for a moment. Our hospital system has been significantly strained for the past 15, 16 months. Both public and private sector hospitals have been under severe pressure. Management have had to make juggling decisions and relocation decisions and move patients around, create more beds, find more nurses, relocate doctors, placate anxious families. And on top of all of this, we now can't safely get our nurses to work in the morning. We haven't got enough catering staff in the hospitals to feed sick patients. We haven't got enough cleaning staff to take care of the facilities and do the laundry. Where do we house our night staff who we can't send home? We've had to let them sleep in the hospitals or arrange alternative accommodation. So the day-to-day complexity of running a complex hospital network has now been made incredibly difficult. We've got shortage of doctors. We've had to close the Life Chatsmed A&E because we didn't have enough doctors. And then we had protesters in Life Mount Edgecombe trying to breach the perimeter of the hospital, and they were chased out by members of the community. So the operational challenges that we're now facing, on top of where we were already stretched perhaps 48 hours ago, are just phenomenal. It's a huge load.
Right, and of course, Peter, this would have an impact on the vaccine rollout as well as the transportation of both vaccines and other medication to healthcare facilities, wouldn't it?
Absolutely correct. Breaks my heart. We had to close our vaccination facilities in KZN today. Just when we were getting the momentum right, the supply of doses arrived in the country and we'd started to get a record number of vaccinations done in a day. And now we have to close the vaccination facility. It breaks my heart just to report this to you.
Talk us through, like I was asking now, what about the transportation of other medication that patients may need? Have you seen a delay of arrivals to the various healthcare facilities because of the riots?
Let's just start with the supply of oxygen. We were short of oxygen in wave 2. We've got all the supply lines sorted out. And today we had to get a special police escort to escort the oxygen tanker to the hospital to fill up the tank. And I don't need to explain the catastrophe that would result if one of those were to catch fire. That would just be calamitous. So all our logistics are now compromised. And a hospital is a living system. It functions 24/7, requires consistent replenishment of medical medicines and other supplies. And these have now all been disrupted, which puts us at a serious disadvantage because our purpose is to deliver quality healthcare. And that is an ongoing responsibility requiring a very well-run system.
Right, Peter. Now, what would you want to see as a solution to the current situation? I mean, the President will be addressing the nation soon, but what is it that he can say that will create some kind of solution to the calamity that we're seeing?
Really, I can only look at it from a healthcare perspective. And for us to battle the pandemic, we need stability in our operational processes so our hospitals can function. We need stability around our country so the massive logistical exercise in vaccinating our nation can continue and continue unimpeded. I implore for peace and for stability surrounding our entire country so that we can actually get our jobs of work done. Failing that, we have got insurmountable battles. So rational, calm decision-making and a peaceful resolution so that we in the healthcare sector, together with government, can get on and do what we are required to do.
And just very briefly, lastly, Peter, you've mentioned that facilities in KZN have been very badly impacted by the riots. Any other part of the country that is bringing you some worry, perhaps Gauteng as an example?
Well, from a COVID perspective, we had 2,225 COVID admissions as of midday today, which is higher than the 2,064 we reached in the peak of wave 2. So our hospital system is under incredible pressure. We do not have in Life Healthcare an available ICU or high care bed for a needy patient. So we are stretched beyond the maximum now. And in that particular context, we need some respite. We're encouraged to see that daily new cases is coming down, but hospital admissions will continue to rise for the next 8 to 10 days, as there is an obvious time lag between new cases and hospital admissions. So we need some respite. We are under serious pressure.
Peter, very dire picture that you've painted for us there, but thank you for your time. That is the Chief Executive of Life Healthcare, Peter Wharton-Hood, painting a picture of the impact of the riots on an already strained healthcare system.